Hey horse friends, I'm Becca Salamone and this is Southern Horse Talk. Welcome to another episode of Vet Call with Dr. E. We have Dr. Jud Easterwood here and he comes and talks to us every month about vet tips and practices, and we really appreciate him sharing his knowledge with us here on Southern Horse Talk. How are you doing today, Dr. E?
Good, Rebecca. Thank y'all for having me again.
Well, today we wanted to talk about something that some horse owners may be worried about this time of year because it's getting colder, and that is winter colic. And you know that horse owners have to worry about colic all year long, but what's the specific thing they have to worry about in winter for winter colic?
Sure. Well, that's one thing I wanted to cover with you, particularly right now, because we've been seeing a lot of cases of it. What I like to term winter colic. Colic just means GI pain in horses, and that can be generated for a lot of different reasons. Anywhere from the stomach going all the way back to the large colon and even the rear end of the horse. So there's a lot of different things that can cause the term what we call colic, but we tend to see a little bit different sort of scenario during the wintertime, especially in Alabama when the grass and forage begins to die and people are feeding much more volumes of hay.
Yeah, definitely. I was reading that that hydration and even dental problems and turnout has a lot to do with all that kind of stuff.
It can. So, typically during the wintertime, you're keeping your horse up more, trying to keep them out of the cold, or the most common thing is people are feeding much more volumes of hay, so the horses have less green grass to eat, so they're eating more hay for their forage, and you tend to see impaction sort of colics or just sort of dry fiber feed stagnation that's where the transit through their GI tract becomes a little bit slower and slower, and things tend to kind of get backed up. And that's typically what we see during the wintertime in horses, especially this time of year in January and February. And I just brought a couple of things here to kind of show you what we use commonly for treatments in horses, especially ones that we see, not necessarily full-blown colics like twists or displacements or anything like that, but when horses eat more hay and tend to drink a little bit less water during this time of year, things kind of slow down and become, just like I said, stagnated throughout the GI tract. And
Okay.
We've got some common products we got here that we used to treat those horses with.
Okay, so what would you do when somebody calls and they've got this problem, and let's say it's even an older horse, because I heard that they have a little bit more trouble this time of year. What would you do for a horse?
The older horses do tend to have a little more trouble because their teeth are sometimes in a little bit worse condition, and just older horses just tend to have more problems during the wintertime. It's tough on the older horses, so we do see it more commonly in those horses. But horses that are on round bale of hay, where they're got a round bale out in the pasture where they can just sit there and eat hay all day long, tend to have this problem a little more commonly than other horses. Say they're getting flakes of square bells. But if someone calls me out for this type of issue, the number one thing I think that can help these horses is mineral oil, which is a common laxative that we use here.
Okay.
And a lot of times we use a nasogastric tube to place into the horse's stomach and provide enough volume of oil to really lubricate their GI tract and help move out any potential impactions, blockages, or just slowed ingesta that may be moving through the GI tract slowly. And then we also give a drug called Banamine. This is one that's called flunixin injection, and that can just help with any GI pain that the horse may be experiencing. You can give this medication in the muscle or in the vein. We like to try to give it in the vein as much as possible, but if you get in the bind and get in any trouble, you can also give it in the muscle. And then we also can get it made into a paste as well, Banamine paste. And this just helps with any inflammation or pain that the horse could be experiencing secondary to that colic episode. And then one other treatment that we use real commonly during this time of year for these type of issues are IV fluids. And that can help really. A lot of times these horses will be drinking less water during the winter. For some reason we think that that cold water decreases the horse's consumption rate. And that's what we feel like. So you got an increased consumption of hay and a decreased consumption of water. So those two things combined can cause some problems. So IV fluids can be hugely important. But a lot of times the combined effort of all of these treatments can really help get your horse over it.
Yeah. With the water situation, I was reading that the temperature thing had a lot to do with it, and also, if people are not heating their troughs, that they can ice over, and they're supposed to drink 8 to 10 gallons a day, and half that time might be ice, and they can't even get to the water. And that is a problem, right?
So that can be a problem. Definitely in the northern states, obviously, is a little bit more of a problem than down here. But for some reason, we feel like horses' water consumption decreases when the water gets cold. They just tend to not want to drink as much as, say, lukewarm water or even warm water during this time of year. So heating your water can be important and help maintain your horse's water consumption. Also providing an electrolyte supplement or just table salt sometimes. Up to 2 tablespoons a day can help increase that water intake and help offset sort of that dryness that occurs from eating the extra hay because they're not eating that green grass during the winter time.
Okay. And most of our viewers are in the South, so about what month should they stop worrying about the winter colic?
Typically in the spring months, March, late March, when the early grass starts to come out and they're eating a little bit better quality forage on their pasture. And that's combined with the water warming up, the temperature is rising, and the horse's water intake is increasing, and also you're feeding less volumes of hay.
Okay. All right. Well, I appreciate you. Go ahead.
Concern year round, but typically during the spring we'll see less of this type of issue that we're talking about today.
Right. And I guess that new grass has more water in it too.
Exactly. It sure does.
Okay. All right. Well, thanks for sharing your knowledge with us today. Appreciate it.
All right, Rebecca. Thank you.
All right. And viewers, you can go to easterwoodequine.com for more information, or you can call 205-663-4000 to talk to Dr. Easterwood. And, you'll come back next month and talk about another topic. Do you have another topic in mind right now?
I don't right offhand, but
okay.
We'll definitely find go one for you.
Yeah, we'll find one. Don't worry. Well, this is Becca Salamone of Southern Horse Talk TV. You can subscribe to the Southern Horse Talk YouTube channel by clicking the button below, and go over to the Southern Horse Talk Facebook group and join the conversation over there. Share your horse story, your pics and your videos, and your Southern equine lifestyle. All right, Dr. E, we'll talk to you next month. Thank you so much.
Okay, see you later.
All right, bye-bye.